Defined as a serious mental disorder where a person's perception of reality is distorted, schizophrenia causes a fragmented pattern of thinking, primarily relating to defining psychological features of cognitive, behavioral, and emotional control, impairing a person's ability to function normally. Recognized symptoms include positive, negative, cognitive defects, and neuropsychological changes, with four types of illness manifesting, such as paranoid, catonic, undifferentiated, and sociodefective disorder. Positive symptoms have no psychological normal comparison and hence relate to the psychotic symptoms. Negative symptoms is the removal of normal behavioral processes, such as providing a lack of response. And cognitive is effective with memory and understanding. A diagnosis is based on at least two of these symptoms as long as they're active. It's seen more in men and women, with men developing it in their mid-teens to 30s and women after the age of 30. Currently, the prevalence of schizophrenia in Australia is about 1.5% of the general population, globally 1% and about 23 million people worldwide, with 1.5 million people that will be diagnosed this year. Stressful life events have been known to become triggers for the condition. This includes abuse, divorce, loss of home, or job. The drug quetiapine, manufactured by AstraZeneca, helps by increasing dopamine in the prefrontal cortex and improving cognition. Approved by the FDA in 2006, it's prescription only and in Australia and administered orally. The maximum concentration is achieved at 1.1 to 2 hours with a half-life of 6 hours, and steady state being achieved in 2 days. Finally, it is eliminated in the kidneys. Side effects that are consistent with withdrawal are drowsiness, dizziness, and dry mouth, and it is important to note that there is not much research and studies that have been done via in vitro and animal studies. There is also always bias potential with studies and influence of use to pharmaceutical influences. There may be variances in some data due to dropouts in trial studies resulting in lower efficacy or misinterpreted